The Voices of Resilience project is a digital gallery of personal stories from RCSI staff, sharing their experiences on overcoming adversity, managing setbacks, and building resilience. In creating this project, we aim to promote the well-being and culture of support with both staff and students here at RCSI. This initiative was a collaborative effort between our social work-led student welfare team and staff well-being office Inspire. From working with our student body, we know that attending to their mental health is a big priority, in particular issues surrounding anxiety, self-doubt, stress and depression. They're also keen to develop skills to support their mental health. Likewise, we know that many of our staff can face challenging situations, both personally and professionally. Drawing these threads together, we realise that our staff and students will experience a mutual benefit in developing a resilience resource. Based on this, we aim to develop a resource that both staff and students could draw to support their own well-being and open the dialogue in a unique way. We quickly realised there was a wealth of lived experience already present in our institution in terms of our diverse staff. We wanted to tap into those experiences of our staff and their stories of encountering adversity and how they manage these situations. We felt if we could share these stories with students, we could inspire them, foster a greater sense of togetherness within the university, and tackle stigma surrounding mental health difficulties. We initially sought participants via WorkVivo, which is our internal staff communication platform, eventually recruiting 11 staff members to the project. Once we had our confirmed participants, we scheduled 2 days of filming on campus, which was supported by professional media services. We initially planned to launch a single montage video on World Mental Health Day, making it available to staff on our WorkVivo platform and on Moodle for students. However, as we started filming, we realised that presenting each story in its entirety was much more impactful. Ultimately, we ended up releasing 11 videos over the course of 2 weeks, with our participants discussing a range of topics from learning how to balance parenting while completing a PhD to coping with personal loss. The videos were underpinned by universal design principles with closed captioning and Irish Sign Language interpretation. I was the project lead for Voices of Resilience. The main responsibilities including recruiting participants, developing a registration form, thematic analysis of the contributions, liaising with media services on the final versions of the videos, as well as managing the release schedule for the social platforms. A key element of the recruitment process was ensuring a diverse representation of staff members, making sure to include both academic and clinical staff, as well as members of our professional service teams. Recruitment was a critical element of my role. To facilitate this, I reached out to staff members directly, explaining the objectives of the project and the importance of their contributions. From my perspective, it was really important to build a trusting relationship and create a space where staff members felt safe enough to tell their deeply personal stories in an open manner. The other key element was making sure that we captured our participants' stories effectively. I worked closely with media services during the development and editing stages. It was essential that the films were relatable, authentic, and reflected the real experiences of our employees. This took a significant amount of planning and coordination, ensuring that our participant stories were respectfully presented. We're very proud of Voices of Resilience as a wellbeing initiative and resource to RCSI staff and students. The contributions for this series have allowed staff and students to connect beyond the academics. The collaboration of colleagues is truly what made this project a success and only shows how dedication, creativity and passion can make a change. The project has paved the way for more profound conversations in the realm of mental health advocacy in RCSI. The stories told have challenged stigmas and given hope to those who may be facing similar challenges. One of our participants shared a very difficult situation of a personal loss that she had experienced, and she since told us that sharing her story has sparked conversation in lifts and in corridors, where people thank her for being open and how this encourages them to do the same. The feedback from students has also been positive. Often, it's hard for students to see staff members as real people who have gone through difficult times and faced their own significant challenges. The project has helped students to identify with staff, fostering a greater sense of community. Students say the videos have helped them feel more connected in their educational journey, and they know they can't expect to strive through their degree without any personal challenges, and they can acknowledge that their setbacks can make them stronger. Our first difficulty was recruiting staff members to get involved. Developing trust with our participants was ultimately the key to overcoming this. Participants needed to be reassured that their stories would be handled with the highest care and discretion, and that the videos would only be shared internally. Another big challenge was generating the level of psychological safety necessary for the participants to be comfortable enough to openly share their stories. We managed this by involving the participants at all stages of the process, including the opportunity to review and approve final versions of the videos before they were released. This level of involvement built trust between the participants and the team and gave them a sense of control over their own story. Ensuring that appropriate care was in place for our participants after sharing potentially deeply personal stories was also an important component of this process. There are obviously a number of logistical challenges in terms of coordinating film schedules, and managing this required careful planning. Working closely with our media services and our project team members helped to ensure that things ran smoothly and professionally. My biggest piece of advice to anyone doing a similar initiative is to acknowledge the wealth of professional and personal experience you already have within your own organisation. Many of your co-workers will have compelling stories that can uplift others, reduce stigma, and create a welcoming atmosphere that actually promotes staff and student welfare. The key to success is to provide a platform for sharing. Establishing psychological safety and trust is essential for a project like this. You can create an environment where real, relatable stories can be shared if you ensure that your participants feel in control of their own narrative and are involved at every step of the process. As evidenced by the range of staff in our project, it's imperative to have support from all facets of the campus community, but leadership support is especially crucial. By becoming involved and sharing his personal resilience story and the message that you're never alone, our CEO has set a powerful example of the value of these shared experiences and creating a supportive culture that prioritises well-being. Lastly, I'd suggest focusing on the objective of initiating conversations and creating a sense of community. In the end, we want our campuses to be places where individuals are comfortable exchanging ideas and learning from each other. This can lead to healthier, more resilient communities where mental health and well-being can be openly discussed.